faces significant challenges when it comes to accessing health care. And we know that we're not alone. Other provinces, other countries are struggling with this very same issue. Here in Newfoundland and Labrador, we recognize the issues and set to work immediately to reimagine an outdated healthcare system. It was one of my motivations to enter politics in the first place, and seeing the strain on the system after years on the front lines. So when I became Premier in 2020, one of the first things I did was establish the Health Accord, led by Dr. Parfrey and Sister Elizabeth Davis. The Health Accord was tasked with reviewing our system and coming up with ways to modernize it, to reimagine it, to create a sustainable system, a modern system for all Newfoundland and Labrador. While other jurisdictions are still grappling with how to fix the system, we already have those recommendations. And we have them thanks to the dedication of Pat and Sister Elizabeth and the incredible team that they put together, who engaged with many, if not almost all, Newfoundlanders and Labradorians, including members of opposite political parties. On Budget 2023, Your Health, Our Priority, demonstrates our commitment to actioning recommendations in the Health Accord, with a record almost $4 billion investment in your health, for you. Our government has a plan to improve health care for all Newfoundlanders and Labradorians, and you see that with almost daily announcements with respect to health care. Things like investing in a consolidated ambulance system with a centralized dispatch, far outdated and much needed. Creating a single health authority. An additional $23 million in recruitment and retention efforts for healthcare professionals. And modernizing our infrastructure through new hospitals and family care teams, bringing care to the people that need it the most. Today, we are adding another piece of that plan. We are launching our Health Action Updates. This approach is designed to present Newfoundlanders and Labradorians with the information that they need to know about steps that we are taking to action a plan that best supports your families and our communities. Healthcare Action Updates will function as briefings, similar to the COVID briefings in many ways, of our latest initiatives in healthcare. They will have specific themes and focus on one or two initiatives that are part of our collective sustainable healthcare agenda. They will be live streamed on our government Facebook page and deliver to you the latest healthcare action information. For example, today we will be giving you more information about the expansion of family care teams that was announced in Budget 2023. Teams that will provide up to 80,000 people with access to primary care. We are also launching our Health Action website. You can go to They
are in that, they're in that stage now of attack.
is of utmost importance to everybody. We will continue to move forward. We can move forward. We can meet the challenges head on. The pandemic has proven that. Healthcare will be changed for the better to a system all Newfoundlanders and Labradorians can be proud of. I'll now pass it over to Minister Osborne. Minister.
Thank you, Premier. Hosting regular healthcare action updates is an immediate and important way to communicate the progress of healthcare-related initiatives and explain how they work. It demonstrates exactly what your government is doing to tackle our healthcare challenges. This is something our team has been working on tirelessly over the last number of months. I want to take a moment to thank the team in the Department of Health and Community Services, as well as those with the new Provincial Health Authority, for their recent efforts to improve your system. Your dedication is second to none, and on behalf of all Newfoundlanders and Labradorians, let me say that we are very grateful for your work. We know that many people ask questions about the actions we are taking to address healthcare challenges, and that's why we are here today and why we have developed this platform. Your health is our priority. Budget 2023 invests an unprecedented $3.9 billion in healthcare in Newfoundland and Labrador. This investment will help stabilize our system and help transform it into a more modern, efficient, and effective healthcare system. Guided by Health Accord NL, we are driving meaningful change across the healthcare system. We are embarking on a number of new initiatives, including a new virtual care program, the advancement of urgent care centres, and recruitment and retention initiatives for healthcare professionals, many of which are being funded through Budget 2023. We are committed to ensuring that Newfoundlanders and Labradorians have the information they need on all of those initiatives. We will do this by fielding questions, providing answers, and giving the people of the province timely updates on how our actions are impacting their health. Today is an example with our first healthcare action update on family care centres. Budget 2023 includes $21.2 million to fund 10 more family care teams for the 22-23 fiscal year, and work is ongoing on adding an 11th team on the Burin Peninsula. Family care teams are a holistic approach to community care and will become the pillars of community health care for years to come. On our Healthcare Action website, you'll see a map which will show you where all of the current and planned family care teams will be. We have 8 teams at various stages of implementation throughout the province, with 11 more being planned for the upcoming year. If you're not familiar with what a family care team is and how it works for you and your family, today we are going to give you a breakdown on how they function and how patients will be assigned to the teams. Before I pass it over to Gillian and Dr. Parfrey, I want to encourage people to keep an eye out for healthcare action updates. We want this to be an informative platform that provides you with updates that you want and answers questions that may come up. Please visit healthcareaction.ca for more information and follow the progress of our initiatives. We do ask that you keep in mind that these numbers will change and evolve over time, as the Healthcare Action website will be updated regularly as information becomes available. One thing that won't change, however, is our commitment to reimagining healthcare and improving the ability of Newfoundlanders and Labradorians to access the care they need. I'll now pass it over to Gillian, the Assistant Deputy Minister for Population Health and Wellness, who has been an integral part of our transformation team in the province.
Thank you, Premier Minister, and thank you to everyone for joining us today. As the Minister just said, as part of my role, I am overseeing the policy development and implementation of family care teams across Newfoundland and Labrador. Family care teams represent a new vision of team-based care to transform our primary healthcare system. This vision is based on recommendations from Health Accord NL and guided by a new provincial health policy framework. Family care teams aim to increase continuity and access for primary care for individuals and families in their communities. As the Premier and Minister have been making announcements to expand family care teams across the province, we thought this would be a great opportunity for the first Healthcare Action update and to take the time to answer some of the questions we've been hearing too. We want to provide you with answers to questions like, what is the vision for these family care teams and how do they work? So you have a better understanding of how we're using these teams to improve your access to care. Family care teams offer seamless access to multiple healthcare professionals. This could include family physicians, nurse practitioners, nurses, social workers, pharmacists, and allied health professionals such as occupational therapists. Team members will collaborate with each other to provide the right care for your health needs at the right time. So, if you are attached to a family care team and you walk through those doors for your first appointment, it may be similar to a previous appointment you would have had at a medical clinic. A key difference is that a team member, usually a registered nurse, will help you determine the types of healthcare best suited to your needs by doing an initial intake assessment. For example, if you have diabetes and your blood glucose is not at target, you may see a physician or a nurse practitioner for your first visit. You may be prescribed a new medication and scheduled for a follow-up visit next month. When you return, you may see the physician or nurse practitioner again, but this time you also see the diabetes nurse educator who had already reviewed the health information that you shared during your initial visit and has some resources ready to review with you to help you better manage your diabetes. If on your first visit or a later visit you have a mental health or family concern, you may decide to see a social worker on the team. The key thing to remember is that this team will work together and with you to help you set and achieve your goals and will connect you to other team members as needed. Your needs will likely change over time, and family care teams are designed to be flexible in their approach to your care. This is just one example of how the team-based care approach will work. As you can appreciate, everyone is different and unique and will have different healthcare needs. Therefore, your experience at a family care team will likely be a different experience from your family members, friends, or coworkers. Over time, you and your family care team will get to know each other. You will be connected to the team for the long term, and at different points in time may receive care from multiple team members. One team member, a physician or nurse practitioner usually, will be known as your most responsible provider, and along with healthcare navigators, will coordinate your care both within the team and with other services and specialists you may be referred to. Your family care team will have similarities to other family care teams across the province, but it will also be tailored to the needs of your community. Your family care team might be located in a single location, or it may use a hub and spoke model. Hub and spoke models are focused on delivering appropriate and equitable care to the entire geographical area and are particularly important in our province to servicing smaller and more remote areas. They allow residents to receive care at the spoke nearest their home and also avail of services in the hub location as needed. The goal is for everyone to be able to be connected to a team and that the team will be linked to other care providers in your community. If your family physician does not work directly with a family care team, no worries, there will be opportunities for them to connect with the team over time so that you and your family members can access services of those team members as well. In Budget 2023, we announced an expansion of family care teams across Newfoundland and Labrador. Today, there are 8 family care teams underway and in various stages of implementation throughout our province. 11 more will be developed in 2023, 2024 for a total.
They are in that, they're in that stage now.
The first family care team was established in the Metro region in 2020 as an initial step to address the unmet healthcare needs of residents who do not have a family doctor. Family care teams are located currently in St. John's East on Mundy Pond Road, St. John's West on Topsail Road, St. John's Centre at Pippi Place, Southern Avalon, Coast of Bays, Stephenville, Bay St. George, and Northern Peninsula and Happy Valley Goose Bay. The 10 new family care teams funded by Budget 2023 will be in the following areas: Clarenville, Conception Bay North, Metro St. John's, Deer Lake White Bay, Port aux Basques, Labrador West, Gander, Grand Falls, Kittiwake, which includes Brookfield and area, and Bonavista, and work is ongoing to add an 11th team this year on the Burin Peninsula. These family care teams continue the work of the very first teams that were established to address the needs of residents who do not have a family doctor. Additional teams will be implemented over the next 4 years until we reach our goal of 35 teams across the province. Family care teams will build on the strengths and will be comprised of familiar healthcare providers and services in your communities, along with added new resources to enable them to practice as a team. As family care teams are in different stages of development across the province, we do need to recognize that it will take time and some patience for all of our planned teams to be fully implemented and staffed. Please know that we are working diligently on it. We hope to have as many of them up and running as soon as possible. In the meantime, please be assured that existing care in your community will continue, although it may not operate from a full family care team model just yet. If you do not have a family doctor, or if you will not have one within the next 3 months, I encourage you to register with Patient Connect. Registration with Patient Connect will allow the Provincial Health Authority to attach you with a family physician or a family care team when one becomes available in your area. It will also help us to identify where there is greatest need for the remaining family care teams that are set to be announced over the next few years. Establishing family care teams is an important healthcare action that we are taking to help us transform our healthcare system. The team-based approach to healthcare will allow for greater capacity to see patients and, as a result, expand quality and access to care across the health system. Before I turn it over to Dr. Parfrey to say a few more words on community care, I would encourage you to register yourself or your loved ones with Patient Connect online at patientconnect.nlchi.nl.ca, or there's an option by phone, 1-833-913-4679. And if you're a health professional that would like to work in a family care team, please visit workinhealthnl.ca to learn more about the opportunities available. Thank you.
I now invite Dr. Parfrey to say a few words.
Certainly. Thank you very much for the invitation to speak from the Premier and the Minister of Health and Community Services. I'm just a brief personal note from Sister Elizabeth and myself, that the idea that this Health Accord NL report continues not to gather dust and is at the forefront of plans by government and by discussions of the 3 political parties. Its success has far outweighed what we had expected. I'm just going to speak to the healthcare side of the Health Accord NL. First of all, a few days ago we had the amalgamation of the regional health authorities into one provincial health authority that will be responsible for implementing the policies of the government that relate to Health Accord NL, etc. And the job that we're trying to do, I suppose, as a health transformation team, is to leave Health Accord NL in the background and move on to the government's plans and the provincial health authorities' plans to implement the calls to action. And one of the major calls to action was around improving community care. And the reason for that was that community care is the glue that holds together the entire health delivery system. And community care is probably also a major vehicle for changing the disease risk factors in individuals and in communities. So the components, the strategic components of our approach to community care revolved around recruitment and retention of providers, not only family physicians, but nurses and nurse practitioners and other allied health professionals, particularly difficult in the presence of a deficit of these people both in Canada and across the world. So it's a real challenge following COVID, where we lost providers. The second piece was around the idea that family care teams and team-based care were going to provide more holistic and better care to the population. The third was around the idea that emergency services are a big concern to people, that if they get a stroke or a heart attack, they want to get to a hospital fast. And our recommendations around how we might do that are being met by the government. And then the fourth piece of it was virtual care, and the idea that one could get urgent, continuing or tertiary care virtually, and for some places that virtual first might be the best solution for delivering care to the community. So all elements of that strategy are being put into effect, and obviously this meeting concerns how you in the media can evaluate the progress that's actually been made in that arena. The other piece that's relevant is around family physicians themselves. And I know from my involvement in Health Accord and Ellen, the multiple discussions that we had with family physicians, that the three major things they were concerned about were respect, and in effect that revolved around things like retention bonuses, etc. Their way that they were remunerated, and that fee per service was a business model that did not suit many of those family physicians, and that they were much more interested in getting a blended capitation model. And then that the third element that they wanted was to work in teams and to work with nurse practitioners and nurses and other allied health professionals and integrate with care of the elderly, mental health delivery, disease prevention, etc. And that allow them to increase the scope of their practice as we increase the scope of practice of all those other providers. So that strategy has now evolved into those three things are now being delivered to family physicians. What did I forget?
Questions? Time for questions.
Fair enough.
We'll open it up to questions.
Emery's had enough.
I want to ask about the purpose of these updates, because the family care teams were announced just over 2 weeks ago.
Yep.
So why do another update and talk about them again?
Well, this update today is to update everybody that we will be providing regular updates, if you will, because you can understand that changing a system requires a long-term vision, a longer horizon that isn't always captured in the day-to-day minutia of some of the announcements. So we want to make sure that that vision towards a sustainable, modernized healthcare system is fully encapsulated. And we feel like we can do that through reminding people on the website of where we're going, but equally updating them regularly with these panels. Everybody lives busy lives. And everyone's running around chasing their children, trying to get groceries, managing family and business issues. So we can appreciate that the day-to-day announcements that we are announcing and progressing may not always stick, and they may not always fit into how you as an individual see the overall vision of the transformation. So providing an instrument through the website and an opportunity for you at home and you in the media to ask questions about specifics in the healthcare system, we think is a good communication plan to ensure that citizens particularly understand how we are rebuilding a modern system that will meet their demands in a timely fashion.
Will you add more context to the website? Because right now when you look, it's like it will show how many nurses were hired, but maybe not how many left the system, and it will show how many graduates were hired, but not how many total graduates there were. Just so that it gives
Sure,
people
yeah. I
more
mean, we
information.
will contemplate adding more context to the website, certainly. But you could see as the platform that what it's intended to achieve, and it's a live, living document and website. So undoubtedly, it will pivot to address and to improve and to address particular needs as they evolve. No one can predict. No one could have predicted the pandemic. No one can potentially predict whatever acute health issue could potentially arise in 5 months or 5 years. So we will certainly treat the website as a living document and update it accordingly.
But I mean, the website says 27 doctors hired since or recruited since June. Doesn't tell us how many have left in that time period, and you said that the goal is to tell residents how we're progressing. How do we know how we're progressing if we don't know how many doctors and nurses have left in that time period?
Well, the key indicator is to know how many people are assigned to, in this case, primary care teams and access to primary care. It is difficult to track how many have left the system, there's no doubt, because people retire. It's difficult to capture that particular metric. What we are trying to capture is how many people aren't assigned to family doctors. So whether that's through, working with, collaboratively with the NLMA or through Patient Connect, that's the metric, that's the important metric that we need and want. It's very difficult to track individuals leaving the system, at a granular level, week to week per se. Yep.
I was going to say, the Patient Connect one is the third one down on the website. Recruit and retention is the first one, but you just said that that's the trickiest one. I mean, without that information, isn't
I'm sorry, I don't understand the premise of the question.
Well, without that information, isn't this more of a marketing exercise on the part of the government?
Well, it's not a marketing exercise, it's an information exercise, it's an education exercise too. And there's a lot of moving parts in the healthcare system right now, as you can appreciate. I mean, just think about the transformations that have occurred already. One Health Authority, changing the ambulance services, creating primary family care teams. These are all, it's a heavy lift in a short period of time and a lot of moving parts. We want to make sure all that information is encapsulated in one spot that people can go and look at and observe and understand how it impacts them. We are concentrated on, there's no doubt that we need to grow the healthcare human resources. That's not going to happen overnight, as there has been a substantial change in the way that nurses, doctors, allied health professionals practice medicine. Whether it's, and it has substantively has to do with work-life balance, and rightfully so. So we know that, for example, a doctor retiring is going to require more to fill their position, and that's why we're looking at increasing the training, availability within the postgraduate residency programs at Memorial, and in increasing the capacity in the med school.
You mentioned
As
document.
reported first in Newfoundland and Labrador this morning, the government has nearly $100 million tied up in travel nurse contracts that most will expire in 2024. This kind of moves away from, I think, what you said a few months ago, Minister Osborne, about trying to move away from these travel nurses. Can you speak to that?
Yeah, absolutely. I mean, we have recruitment missions right now. One of those, for example, is the recruitment mission to India. We've been upfront in saying that there's a 4 or 5 month process at best to get nurses from India through the work visa process, which is a federal process. We have a number of graduating nurses who have already accepted positions in the province. I think every minister in Canada would be anxious to get rid of the nursing contracts or the agencies and have a more stabilized workforce. But that takes recruitment. So once we start seeing the nurses from India, as an example, come to the province, we'll have less reliance on the contract agencies. And those nurses that come by virtue of their work permit have to take permanent positions within the healthcare system.
Just the comment, one comment. When I started practice and when I was a medical student and resident, there was a cry from the nurses that I worked with that the government wasn't offering full-time positions because that came with the subsequent benefits and pension. And that was the major cry in the ORs and the emergency hallways everywhere. There has been a significant shift in nursing, not in Newfoundland and Labrador, it's consistent in all other premiers that I speak with, that there's been a shift towards casual nurses and people graduating not wanting the full-time jobs and not wanting the pensional benefits and the disability benefits and the guarantee of that, but instead wanting the flexibility of being a casual nurse. That exists across every province, but it is a huge market shift. It's a huge shift in the market dynamics of that employment space. So we need to work with the nurses union, as we have, to recognize that it is more than it is about trying to achieve the right professional personal balance for these nurses on the front line, to ensure that we're meeting the demands and expectations of the new generation of nurse, while equally respecting the nurses that have been on the front lines for some time. There's no easy answer to that. Part of it is recruiting from elsewhere. Part of it is expanding our own nursing school, which we have done by 25%. And part of it is creating new infrastructure, frankly, for them to work in, to have a more rewarding career in, while allowing for the new design of things like childcare being available for them in a new piece of infrastructure. So no one wants to use travel nurses. There's no premier who wants to use travel nurses. There's no minister of health who wants to use travel nurses. The reality is, during this shifting dynamic of a marketplace, if you will, within this professional shift, we need to make sure that we are using what resources are available to continue to provide care.
Governments have been pretty, open about healthcare investments. There's been announcements, sometimes multiple announcements a day, on money that we're spending on healthcare. this was very hard for us to find. This was not publicized. Why are you not being more, I guess, transparent about your reliance on travel nurses? These were all sole source contracts. There's up to $100 million. It's a ton of money. Why did we have to kind of poke around in the back ends of the internet to find this information? It's not in Merck's. It was all sourceless. It was all just, you know, difficult to find, put it that way. It
Yeah,
wasn't
so-
budget.
I mean, the answer to that, these contracts are done through the 4 different health authorities. We now have 1 health authority. It'll certainly be easier for us to track that now, but the contracts were sole sourced at times through the individual health authorities, not through government. Government provides the annual operating grants to the health authorities, and they utilize those grants then to provide the best care they can to the people of the province. I do understand the need for for the 4 health authorities to have contracted nurses if they had shortages of staff. But again, as I said, as the Premier have said, we are looking forward to a day that the province is no longer reliant on agency nurses, that we have a stabilized workforce. And I think every province in Canada will tell you the same thing. And, the nurses that are working with the agencies at that point will then migrate back to working in a health authority in one of the provinces.
On the topic of nurses, the Registered Nurses Union has some concerns about the announcement that was made in regards to the payment for nurses who might have extra tasks now, such as making prescriptions. Can you speak to those concerns?
So, all I can say is that there were consultations with the department and the RNU on this. Prior to the announcement, I'd actually called Yvette Coffey and said, do you have any further questions on the announcement? The response was, this is good news. We've been waiting for this for some time. What's said behind closed doors, what may be said publicly, I can't account for that.
So there won't be any changes to their pay with the extra responsibilities?
So the Registered Nurses Union right now, there's 2 things to keep in mind. One is there are 3 modules that have to be attained before nurses can prescribe. We're looking at about a year before that happens. There's plenty of time to deal with that issue because it's a year out. The second is the RNU currently is in negotiations actively as we speak, and some of those issues will be dealt with at that table.
Back to the healthcare action, just wondering, do you think that laying this information out like this publicly and tracking this information, that it will help in terms of your recruitment nationally and internationally?
We certainly hope so. I've heard from doctors that I know across the country that are quite impressed with the incentives and the come home year incentive, for example, the incentives that we provide for difficult places to fill across the country. And this is, again, a way to capture all the things that we're trying to do, recognizing that there is a lot coming at patients and providers alike during this time of change. So, I don't take this as a marketing exercise. I take it as an education exercise, as an information exercise, because if we don't have it, we'll be accused of not providing it. So this is our attempt to be transparent and open as best we can, recognizing that there will be flaws and there will be ways to improve it, but to ensure that Newfoundlanders and Labradorians get the information they need when they need it, and if that's deemed a marketing exercise, then so be it.
Is there one final question?
I can ask mine after. I can ask it, okay.
Go ahead.
It's just a simple question. Which department is responsible for updating this website?
So primarily, I guess, the Department of Health and Community Services, but we'll be working with the communications branch in ensuring that the website is updated.
Thank you.
Great. Thanks, everybody.